All right, let's turn to this story now. 124 fake doctors have been arrested following a crackdown by the Health Professions Council of South Africa. Health Minister Dr Joe Phaahla says raids were conducted at various sites. The South African Medical Association chairperson, Dr Mvuyisi Mzukwa, joins us now for more on this story. Dr Mzukwa, good to have you, and thank you very much for your time. Admittedly, the 124 fake doctors were arrested over a period of 3 years, the minister tells us. But what we do know is that cases of people masquerading as doctors are not new in South Africa. Maybe one could even say not new in Africa, not new in India, not new if you look at the plastic surgery cases, for example, overseas. Not new there also. However, it is certainly a cause for concern, because there is a shortage of doctors, in other words, a deficit, and there is a rising demand in terms of healthcare services. If we start at this point, who has or where does the primary responsibility to deal with cases of fake doctors lie?
Good evening to you, Thabo, and to your listeners and your viewers, and thanks for having me. Thabo, like you said, this is a global phenomenon. And South Africa is part of the globe, so obviously tendencies like these would be found also in our land. Like you said, there are many issues to consider here. One is that the HPCSA is the one that should verify in any practicing doctor, because it is the statutory agency that must protect the public, and must also make sure that all the doctors or everyone who's opening up a practice is registered. But also, we understand that HPCSA cannot do this alone. They need to collaborate with other stakeholders like the law enforcement agencies, but communities as well, on the ground. They need to be empowered to identify, these bogus doctors.
Yeah. Is there a link, I suppose, when you look at our context, between the rise of unqualified people who are ripping off unsuspecting patients and the shortages in terms of doctors and the demand that we have for healthcare services?
Well, I don't think necessarily it is because of that. It may contribute, but I think the issue is that, you must look at the approach by these bogus doctors. First of all, they will charge very low fees because they want to attract people to come to them. But also, like you said, it will be in the rural areas, in the cities, where you find that there's a lot of congestion, and there's a very slim chance of being detected by law enforcement agencies. But the issue is, the state of our economy it might be the cause, because if you look at some of these, they charge very low rates on the ground.
And when we then look at that, and particularly the economic implications thereof, how do you deter such behavior? I mean, is there appropriate action being taken? In other words, cases that are being investigated and prosecuted, are they being done quick enough, the pace at which they are done, and is that offering enough of a deterrent for would-be, I suppose, fake doctors?
Well, I think from every corner there is a challenge of backlogs. If you look at, for example, our judiciary, they've got a backlog of cases, that they are dealing with. But also, if you look at the HPCSA, it's a very small entity. But I don't believe that they are incapable of cracking down on these cases. But look at the SAPS as well. They've got low numbers. So, that's a very conducive environment for these criminals to thrive. But having said so, I do believe that this has serious implications on the healthcare of the country and the society. So it is imperative upon all of us to make sure that we report such cases when we actually detect them, or even if we're suspicious, we must be able to report to the local law enforcement agencies, or even approach the HPCSA to say there are suspicious cases in our area, and we do think that your intervention is necessary.
Yeah. Look at, for example, in Kenya, and we look at, for example, in Nigeria. I mean, they have come out clearly to say what is causing their situation. One is a lack of funding within the healthcare services in terms of how much is being spent compared to the GDP on public health. Poor infrastructure is one area that they are citing, and poor logistics. If we look at what South Africa is spending on the health sector allocation compared to the GDP, I mean, government will tell you that we actually are spending much more than many countries would be doing currently on the region. Is that true?
Yes, according to the statistics, yes, it is true that we are overspending. But if you look at the outcomes, health outcomes were low down there. So it really, our spending it does not really assist with the health outcomes. But having said so, we are sitting at 30% of the necessary workforce on the ground in South Africa as per the World Health Organization. So if you look at that, we are still very short of healthcare workers on the ground. And people, if they cannot get assistance, in the state or wherever, they will obviously look for alternatives. Yeah. And unfortunately, they then go outside of the legal ones, and even are victims of the bogus doctors.
Yeah. Let's talk about that ratio. I mean, I don't know if it's the relevant ratio. 10 to 10,000 patients is what the WHO is suggesting. So 10 doctors to 10,000 patients. Where are we sitting?
You'll recall that we are sitting very low at, if I'm not mistaken, I think we're sitting at 0.8 doctors. Yes, so it's we are sitting very low, and you know that we're having lots of production in South Africa, but our doctors, after community service, they are not employed. They then go to other countries, attracted by first world countries like Canada, UK, and other areas in the globe. So it's important that as we produce, but also we absorb and retain, professionals in the country. We can't be saying we're heading towards NHI when actually we are not retaining doctors and nurses on the ground. There's a shortage of nurses, but there's no funding, from government that's coming to capacitate the healthcare system as we speak.
Yeah. When we are then looking at our systems, for example, checks and balances, is there something that needs to happen in terms of strengthening the systems? Take us through, for example, what happens before a license is issued.
Well, if you qualify from the medical school, then you need to do your internship. South Africa is 2 years, and then you go for your community service. But after community service, you need to get then a certificate that you are an independent practitioner. It must be issued out by the HCSA. That certificate allows you to work independently in the state or privately. And if you want to practice privately, then you need to apply for a practice number from the BHF, Board of Healthcare Funders. So it's the HPCSA and also the practice number from BHF. So those two things are very important if one is to practice in South Africa. So if you don't have a practice number, you can't actually use another person's practice number.
And this is not something that can be, I suppose, acquired easily, or are there people who are working probably in the black market who are able to produce these license numbers?
Not necessarily, but what happens is that, you find that they operate without them. Most of them will operate without them, but also they would fraudulently obtain these, from the registered doctors. So, and they usually work in syndicates, and, find them issuing out sick notes, from a real doctor, but find that the doctor is not even aware of such cases. But also you do have some colleagues who may have employed them thinking that they are properly registered with the HPCSA. Because if you look at the document, they look legit in terms of having stamps from the HPCSA and the logos. But when you actually go to the HPCSA, I register, I find that this doctor does not exist.
Yeah. And particularly is there a way, for example, in which other processes in the system that could pick that up? For example, if somebody is acting as Dr. Mzukwa and writes a prescription and I take it to a pharmacy, is there a way of the pharmacy to pick up that actually the surname that is on this particular script is of somebody else, but this practice number is pointing to somebody else, and right there begin to raise red flags?
I am not sure if pharmacists are capacitated in that regard, but it would be a good thing if we were to have such a system in place. But as we know now, it takes time. It takes years before the bogus doctor is picked up, from the community. So such cases need, to be implemented. We need an innovative private sector. Because most of these doctors are out there in the private sector, even though at times you do get some from the public sector.
So there's a broader conversation, and of course it's been had about the nurses and the inhibitions or the restrictions and limitations that are being put on nurses to qualify and having to go to university. Now it's no longer just qualifying at the colleges, and it's a whole conversation all on its own. But let's look at the conversation around doctors. Are our universities producing enough, and do we have maybe enough universities producing doctors?
Well, I wouldn't say enough, but if you look at the numbers that we have now, you would know that we have our own medical schools, about 9, if I'm not mistaken, 9 medical schools that are producing. But we also have a cohort that comes from Cuba. Not only that, we have other doctors that go outside of South Africa, and study medicine, and they come back to South Africa, write board exams at the HPCSA, and they qualify. We've got lots of those that are not employed at the moment. So I do think that, production-wise, as I said, we still have enough. It's just that the system is not absorbing these doctors to come in. So if Treasury says they don't have money, obviously hospitals don't have any funded posts, to absorb such doctors. And what they do then, they leave, because these are young people. They'll go to other countries where they can continue their lives. They can continue to earn salaries there. So the problem is absorption and retention of those that are produced in the country. Yeah. And unfortunately, we as a third world country, we are training for a first world countries. You hear politicians running around wanting to stop other nations from recruiting from South Africa. But what do you do when you are not employed by your own country? You then go out and seek employment elsewhere.
And how true then is the view that says, for example, the most, as you mentioned, people who would be taken advantage of are in rural areas, and the reason is because young doctors are not willing to go serve in those rural areas, and that opens up a space and an opportunity for unqualified people to take advantage of people in those areas?
Yes, there is a serious challenge, the distribution of the workforce, in rural versus the urban areas, also private versus the state. But also you must recall that, the conditions in the rural areas are not conducive, for doctors to practice there. So, you can't hope that by producing lots of doctors, then they will ultimately go to the rural areas and start practices there, when actually there is no running water, when there is no electricity, when there are no roads, when there's so much that's going on in the rural areas, areas that are neglected by their own government. And we cannot just think that, healthcare workers are going to resolve those socio-economic problems in those areas.
Yeah. Minister Phaahla, pinning a lot of confidence in the Inspectorate Office. It has been established since 2014 and has been doing the work. And our ability to regulate, leaning pretty much on that inspectorate to do the work. Do you think that's adequate?
Well, I don't think it's necessarily adequate because I don't think it is having enough numbers, to be populated in the whole 9 provinces in the country. I do think that, other collaborations are important, like I said, law enforcement agencies, but also, churches, civic organizations, and all the people that are supposed to assist in this regard. So I do think that if we put our hopes only on that inspectorate office, I don't think we'll be able to crack down, because I do believe that we've got lots of these bogus doctors who are out there in the country, in different provinces and in big cities as well.
Dr. Mzukwa, as always, much appreciated. Thanks for coming on. That is Dr. Mvuyisi Mzukwa there on the arrest of those 124 fake doctors and the work that is continuing to be done by the Health Professions Council of South Africa, certainly to curb the rise of numbers in bogus practitioners.